Paster with us today.
We're taking your calls at 270-9933. Hi, Zorba.
Hi, guys. How are you?
Good. While we're waiting for some of the calls to clear, tell us about this new study about men who exercise.
Right. Well, it's a new study in the journal Diabetes, and we've known for years that women who gain extra weight during pregnancy are much more likely to have a child who inevitably has glucose problems and may inevitably have obesity problems too. But this looked at men, and it looked at men who exercised before they actually got pregnant. I mean, the men obviously didn't get pregnant, but actually engaged in sex and conceived a child to see whether or not a healthy man is more likely to have a child who is healthier. And lo and behold, men who went to the gym before they conceived a baby were more likely to have a child who had less problems with obesity, appear to have less risk of diabetes, and had a lower fat mass. So it may be that male exercise prior to conception may be just as important as a woman getting ready for conception too. The more we learn about babies, the more we learn about preconception and early conception is really major issues to keeping a child healthy. So stay tuned.
That is fascinating to me.
Very interesting, yeah.
Yeah, it's fascinating that a guy can actually make a difference. So maybe that it's more than just the sperm. It may be that that produces a healthier sperm that actually makes a difference in the way the child is conceived. We're only just now beginning to understand what goes on prior to a baby being born, but all we know is that it's very complex.
Yeah.
It certainly is. All right, let's get to the
for sure.
calls. We will start with Donna in Janesville. Hi, Donna.
Hi. I had a question about over-the-counter toenail fungus treatments. Do any of them actually work, or is there an ingredient that I should be looking for?
Sure. They don't work. That's the bottom line. It would be nice to make them work, but they don't. There's a treatment now, Lamisil. It's a pill form, usually well tolerated. Used to be very, very expensive. You don't see it advertised online on the television anymore because it's become generic. The pill you can take for 7 days, then you stop for another 3 weeks, and then you take it for 7 days, stop for another 3 weeks, and 7 days. It's called the pulse method. So it's 3 7-day treatments over a 3-month period, 80% effective. It works. There's also a prescription, if you will, prescription nail polish that you can use that's antifungal. You have to apply it again for about 3 months. But the over-the-counter remedies do not do a thing.
So
all right, good to know.
Call your doctor, get a prescription.
Let's go to Sandy in Stoughton. Hi, Sandy. What's your question?
Hi, I have been taking lipoflavonoids for ear hissing, actually. I don't have ringing, I have a hissing sound. Is there anything that works? Because this doesn't seem to be working.
Well, unfortunately, there's not a lot we can do for ear hissing or ear ringing. There are a few things. One of the things you want to do is protect your ears if you're around loud noises. So if you're going to be on an airplane, you want to protect your ears with something to decrease the noise. If you're going to mow the lawn or work on a snowblower or something else, the ear protection things are very important. And the other thing is, if you look on ringing for the ears and you Google it, what you find is just a little bit of music or noise that you have in the background will help with the hissing and ringing. But unfortunately, we don't have a great treatment. The other thing that works for a lot of people is to get better hearing aids, because hearing aids can reduce the hiss because they increase the amount of hearing and things that we hear around us. So good luck. Good luck.
All right, let's go to Bob now in Fitchburg. Hi, Bob.
How are you?
Good. What's your question?
My question is about eczema, and I called you way back, and they use steroids for eczema, the Krista and things like that. What do you think about the cause of eczema? I mean, could it be internal or inherited? What's that?
Well, the cause of eczema, we don't know. We know that it runs in families. We know it can be associated with a bunch of other things, such as allergies. So we understand that, but we don't actually know the causes, the genetic causes of eczema. Undoubtedly, genes play a role. And undoubtedly, if you wash yourself in the shower too often, if you shower like twice a week, it helps keep your skin actually moist versus dry. That helps too. But we do not know the cause. Sorry.
All right, let's go to Dylan in Madison. Hi, Dylan. What's your question?
Hi, doctor. Recommended treatment for shingles that started on the scalp that is now on the forehead.
Antiviral medications, best taken within 24 to 48 hours. They may still work at 3 and 4 days. The antivirals, such as acyclovir, are very effective in helping to reduce shingles. If it's gone out more than 5 or 6 days, then we treat it either with a drug called gabapentin, an oral drug, or we treat it with a lidoderm patch. But the antivirals will help shorten the course. They've been found to be effective, and they're approved by the FDA.
And there's a shingle shot now.
There's a new shingle shot. There's been around one for about 20 years. It's about 60% effective. The new one by GSK is 95% effective. It's on back order because there's so many people who want it. Stay tuned. Call your doctor. Call your pharmacy. It's a 2-shot regime, 95% effective. Everyone should get it. Everyone who's over the age of 60 should get it, rather.
All right. But we are out of time for now. Thank you for everyone for calling in. And Zorba, thank you for your time.
Great to see you, Zorba.
Thank you, guys.
We'll have a final